Hi, I'm Jason Shoultz with the Steinberg Institute. Thanks for joining us today. A team of San Diego Union-Tribune reporters, editors, and photographers spent 72 hours embedded in various parts of the county's behavioral health system. We're talking about psychiatric hospital, law enforcement, crisis response, the 9/11 system, and even the courts. It was a comprehensive project produced by the news organization Eye-Opening series, revealing the scope and the challenge facing communities really across California. It's a system that's strained by a lack of staff and a growing mental health and substance use crisis, and one that folks all across the state are very familiar with. Let's take a look at an overview of this project.
Last month, Governor Gavin Newsom visited San Diego to propose a bond measure that could provide more mental health resources across the state.
To set aside and prioritize the most acute challenge the state faces, and that's the issue of the integration of housing and the supportive services that would need to be stacked on that housing to stabilize individuals that are in acute states of psychosis, people that are self-medicating with drug or alcohol addictions.
San Diego is one of many regions facing a mental health crisis. It's on the streets and in jails, in our classrooms and houses. But what that crisis looks like minute by minute is rarely seen. Reporters with the San Diego Union-Tribune spent months taking a deeper look. Here are some of our starkest findings. Over the last 3 decades, the rate at which people were placed on 72-hour mental health holds has almost doubled for adults and increased nearly tenfold for kids. Mental health calls for service to law enforcement have spiked by more than 120% since 2009, creating backlogs at all levels. Hospitals are struggling to staff the hundreds of available psychiatric beds, and people who are discharged sometimes have nowhere to go. Over the past decade, the county has lost 68 residential care facilities that had supplied spaces for more than 500 people. Unsurprisingly, the largest provider of mental health care in the county isn't a hospital system or a nonprofit or a crisis center. It's jails. During just one 3-day period that we examined last year, law enforcement in San Diego County received at least 238 mental health calls. People called for help from transit centers, schools, and homes. At least 90 people were admitted to psychiatric facilities, and 5 took their own lives.
I'm thrilled to be joined by Union-Tribune reporter and editor Lyndsay Winkley. Thanks for joining me. And also Luke Bergmann, San Diego County Director of Behavioral Health. Both very familiar with this issue, going to talk with me today about not only the larger picture in the county, but policy implications and things of that nature. So first of all, Lyndsay, congratulations on this in-depth report to the entire team there. I think you really covered the scale and comprehensiveness of this issue quite well. Why did the newsroom want to pursue this?
Yeah, I think, obviously there was a lot of areas that we wanted to take a closer look at, but I think that if you boiled it down to what we were really hoping to accomplish with this project, it was to help people understand at a much more human level the scope of our mental health struggles. And not like, when I say our, I don't mean like you and me, although it could be you and me. What I mean is like our community's struggle. And that can be really hard to visualize for people who either don't have, some sort of personal connection to it, or don't work in the field, because a lot of it is very shielded, rightfully so, by a lot of privacy regulations. And so I think it makes it difficult for people to grasp just the sheer amount of the encompassing nature of this struggle and the amount of people who are working to find solutions.
One of the things that I took away from it was the scope of the issue and the fact that all of this happened within a 72-hour period. To me, that was the most eye-opening fact. Obviously, folks in your newsroom are familiar with these. You cover these issues all the time. Was the newsroom surprised at the level or of the challenge?
I think so. I think that we all knew that it was going to be a really heavy lift. And this project took a really long time to put together. And, if we didn't have the cooperation that we had from like Bergmann and his staff and other people across the county, there would have been no way that we would have been able to do this. So I do think we had a certain sense of the scope. But I don't think anybody could have predicted what we were going to see during those periods, or just the incessant nature of it. I mean, I think we sort of knew that was what we were going in to see, but I think seeing it, being there, and just experiencing sort of the breadth of everything that happened in that period was startling even for us.
Well, you mentioned Luke Bergmann. Luke, let's bring you in here. Obviously, very familiar with all of these challenges. I'm sure you were engrossed by the report as well. I would love to get your reaction as a professional who's worked in this field for so long.
Well, I want to express gratitude directly to Lyndsay for her and her colleagues' work on the story. I think that the Union-Tribune was successful with this kind of primary metric that Lyndsay mentioned, which is kind of the humanization of the story, and I think the conveyance that they were able to achieve of something around the sense of scale and just continuousness, right? The word that Lyndsay just used was sort of in incessant nature of the challenge. This is something that gets talked about, it seems, constantly. It's sort of front and center in so many policy conversations right now. But it's also a thing that that isn't very visible to most people most of the time, at least not in a sustained way. And I think there's even something valuable about the fact that this story was, though obviously attended by some kind of lovely video production, that it's in print. That it is something that it sort of like, requires its audience to kind of sit with for a more sustained period of time, because our right, the sort of general public's engagement with this issue is almost always fleeting. And, and when there are moments where encounters happen, those of us who are not suffering with mental illness often do everything we can to make those encounters especially fleeting. And so I really appreciate the depth of the work, the breadth of the work, and the sort of sustained attention to the issue that it's bringing.
Luke, I'm curious, as a person who is responsible for the entire county, the behavioral health system there, what do you want folks to know after they've read this, after they've watched the video, seen the photos?
Yeah.
What is the takeaway, and is there something that you would hope that they could take away from the story?
Yeah. Well, so I think it's important for people to recognize the multiplicity of touch points. I think the work was very effective, and that was evident, Jason, in some of sort of your introductory remarks. Right, this is happening, it's so much a part of so many parts of our lives. I think that's really important. There is something that I want people to take away that I think the titular sort of framing of the story, I think may not fully capture or convey, and that is that what we really need to focus on in order to to really move the dial here, in order to actually make progress in transforming behavioral health, in order to make progress in fixing this thing that it's so easy to describe as broken, we need to think of not as an investment in the mitigation of crisis, simply, not as an investment in the, what it tends to be the preoccupation of folks in this conversation, which is like, what do you do in a moment of crisis? How do you wrap your arms as a kind of set of systems of care and population management around a person in crisis, and then do something with that person and do something with that moment of crisis? That's the policy preoccupation, and we see that in things like Care Court, right? Which sort of is proposed by the administration, recently legislated into action. San Diego County is actually a pilot county for CARE. We see that in the perennial, kind of legislative considerations of LPS, or mental health hold reform, right? So, and there's really important legislation being considered now in Senate Bill 43. What we need to focus on is the longer trajectories of need for people with serious mental illness or behavioral health care needs generally. Mental illness is a chronic illness. We use the language of crisis, and I would just say in a way that's kind of peculiar. We don't use, as a just kind of matter of basic parlance, the word crisis when we talk about any other facet of healthcare. We talk about acuity, we talk about criticality, we talk about intensiveness. We only talk about crisis when it comes to mental health. And when you sort of interrogate that a little bit, right, it is a loaded notion. And it reflects something very deep, I think, about how we as a culture are kind of struggling to grapple with what this is, this kind of, this non-normative thing that we make normative as criminality, that we make normative as disease, right? We have different sort of, I think, tactics and tools for trying to make it normative, but we don't ultimately. Ultimately, what we do is continue to call it crisis. And I think that does something to, perpetuate our focus on these short intervals, on these fleeting encounters. What we really need to focus on as a question of the public narrative, and as a question of policy emphases, and as a question really of care infrastructure, is what do we need to have in place to care for people over not a 72-hour period, not a week, not a month, but years and years. And what is it that we can do to make that system really enable people to live with a sense of purpose, not as people being cared for, but as people living lives and in pursuit of really of their own ends.
You talk about crisis, and that's definitely been a big focus. And in my mind, it feels like an area where the state has made some progress. It's slow, but the 988 rollout would be a good example. The 988 legislation, we were happy to be a co-sponsor of that. It's a step in the right direction. There's still work to do. I do want to touch on the PERT program that was highlighted in this series. And there's a great video clip that I'd like to share with folks here. Let's watch that.
I begin my day at 10 a.m. So it's right about the time typically where calls begin to happen that are mental health related. It really helps me out when I'm introducing myself to people, just giving my first name, keeping it very informal, and letting them know that I'm a registered nurse, that I'm not a police officer. I get to use all my nursing skills in a day. I do a lot of triaging medically in the field, and I always explain mental health as a freight train running downhill without brakes. And then when things begin to happen, they happen all at once. I have to have my faith that I'm in the right place.
We talk about law enforcement not being as involved in crisis response. And Lyndsay, one of the things that came out in this series was the fact that law enforcement, they're struggling with mental health as well. They are faced with those challenges, and even calls for help for them have gone up. The idea of reducing law enforcement engagement with folks having a mental health crisis is obviously a noble one, and that's really the goal. Lyndsay, law enforcement is your beat. It's one of the things you cover. What are you seeing out there? Do you get a sense things are getting better in that area, or what do you see?
Oh, that's such a complicated question. I'm not sure I would frame it quite like that. I think that really, to touch on something that Luke said earlier in this conversation, I do think that there is this really complex handoff happening right now, right? I think that in a lot of ways, our system is sort of buttressed to address crisis. And I think that there's a really clear understanding that we need to step away from that space. But doing that at the same time is difficult. I think that there is sort of this vestige of crisis care that is really is really part of the way that our system works right now. But I also think that there's a really clear understanding that we need to do things differently. And so I think that you see that in some really innovative ways in San Diego. So we have our PERT teams, which have obviously been around for decades. But we also have our mobile crisis response teams, which are relatively new. There's not as many of them. But I think that those two programs really go to show that, the county is trying to think creatively about that. But as far as, sort of the challenge of law enforcement, yes, I think that the numbers are very clear. The number of mental health calls that police officers and deputies in our county are often called to help resolve have increased markedly. And law enforcement is one of the first institutions to say that that is not where they would like to be. A lot of departments have done a really great job at sort of expanding the way that they train their officers to handle mental health crises if necessary, but they are some of the first to say that it's not their area of expertise. They are not trained professionals, and a lot of them want that care. And I think that that is actually illustrated really well in the number of times times that PERT clinicians are asked for. Law enforcement want that assistance. They want those professionals at their side.
Excellent point, Lyndsay. The law enforcement is asking themselves for this help. Luke, I want to touch on something else that gets into our challenge of upstream issues that we face, which is the workforce shortage. The county recently announced an innovative solution to this area. Would you like to touch on that a little bit?
Sure. I'll say just a little bit more by way of background. In the last fall, actually, we released a report on the behavioral health workforce needs, a lot of which was really anchored in Bureau of Labor statistics. So this was needs not just peculiar to the public behavioral healthcare system or the behavioral healthcare system most kind of responsive to the needs of people on Medi-Cal, but more broadly. We've got 17,000 people working as a part of that broad behavioral healthcare system in San Diego County. We estimate that over the next 5 years, we are going to need to more than double that workforce in order to address need, just to sort of give a sense of scale. So we're estimating that we need an additional 18,500 people in our workforce in order to meet need. It's a little mind-boggling. It seems almost kind of ridiculous to consider, but I think it's a really powerful index of the extent of need for change, that when we aim to make behavioral health care better, we need to have that kind of that degree of that extent of change in mind. We don't need to simply be sort of tinkering around the edges. We need to be making deep shifts in how we work and what our expectations are. We are bringing forward to the state later this month for approval an initiative that our Board of Supervisors, in fact, just approved this week, approved sort of me to carry forward to the state, that would use Mental Health Services Act funds in a very innovative way. It would use the innovations component of Mental Health Services Act funds to develop a set of initiatives that are meant to kind of stoke the pipeline of folks prepared to do behavioral health work, sort of, across categories. It would create an upskilling opportunity so that people have opportunities to promote across job categories and across credentials over time. And I think most interestingly, it would create opportunities for people to have help in purchasing homes in San Diego County. And we're very interested in kind of exploring, and we'll be engaging an outside entity to help with evaluation of this. But we're very interested in exploring how that might help us retain people here. We have a wonderful university in San Diego, University of California, San Diego, which has a great community psychiatry residency program. But it's very hard to keep people here. And it's hard for me, as director of Behavioral Health Services Department, to hire doctors into my department because cost of living is so discordant with kind of conventions of compensation for this work. So we're hopeful that some of these, kind of innovative efforts will pay dividends. We will certainly be studying it very closely and be sharing the results of that work with a broader community of behavioral health providers and workers.
I think it's a great example of how the challenge that we face with our mental health crisis is layered, and then on top of that, the workforce shortage is layered as well because of housing costs and all those types of things. So good luck with your efforts.
Thank you.
Luke, before we wrap things up, in a moment, I'd like to introduce folks to Crystal Jenkins, who was highlighted in the series. She was going through the behavioral health court program. But before we do that, I'd like to ask you both, is there anything that you're seeing right now in our system, in our challenge, that you caught in the story, Lyndsay, that gives you some hope for the future?
Yeah, I think there's so much to be hopeful about. I think that's one of the reasons why we took such a person-focused angle on this story, is that mental health is something that people live with every day. Serious mental health conditions can be addressed in a really effective and a really sustainable way. And there is a whole community of people who are very focused on creating, healing for individuals who are in that space. And there are so many resources that are available for people who may find themselves on that journey now, for families, for the person themselves. So there's a lot to be hopeful about.
Luke, how about yourself? What gives you hope right now?
Well, I wouldn't do this work if I didn't have a deep sense of hope about, sort of opportunities that we have to make single people better in critical moments and over the long haul, and that if we didn't have meaningful opportunities to really genuinely make the system something that works better by making substantial change to it. So hope is my fuel every single day, and a lot of what was gratifying, again, about and to sort of see in the work that Lyndsay and her colleagues did, is to just see the kind of beautiful, mission-driven, passionate array of people engaged in this. These are people who are doing jobs, but it's not just work. It's really driven by a sense of deep commitment and love, frankly, for the people they're working with and for the nature of the work.
I think Crystal's story highlights that quite well. And so before we wrap things up, I did want to let folks meet Crystal and the video clip that she had as part of the story. A little backstory on Crystal. She was going through the behavioral health court system because of an incident that she was involved with earlier. And let's watch the video and we'll go from there.
I was living in my apartment downtown, and I all of a sudden started hearing voices. I was hearing that my daughter was getting molested, and I was hearing it in my son's voice, my brother's voice, my sister-in-law's voice. I mean, it was really, really horrific, horrible, perverted things that I heard. I didn't just react right away, but after dealing with it for months, I just couldn't take it anymore. I went in the hallway in my apartment complex. I think I said, like, who's saying this or whatever, and my neighbor came out, and we shared some words, which I don't remember exactly what they were. And then I went back up to my apartment, and the police came. After I told them what I was hearing and everything, they took me to Jane Weston Mental Health Services downtown. The neighbor pressed charges while I was in the middle of my assessment, and so that's why they had to arrest me. And while I was in there, the program came up. And so we kind of got together and talked about it, and I qualified. So instead of being in jail, I'm in this program.
And Lyndsay, I think that touches on what you were talking about, which is there is hope for folks to get through and get to recovery. What were your thoughts about her story?
Yeah, I mean, I think we were really touched by Crystal's sort of persistence and her willingness to sort of see these programs through. That's one of the things that our reporting found, that, her story isn't everybody's story. It can be really difficult sometimes to stick with these tools that are available. But I think that Crystal was such a, she was such a touchstone of this. This can happen to anybody. It can happen to you. It can happen to me. It can happen to your neighbor. It really isn't as foreign as I think it sometimes seems, because we don't always have connections to mental illness. But it really is something that anybody can struggle with. And that is why it is important for all of us to be committed to making sure that the systems that we have in place are serving people over the long haul, right? That we really do need to move away from helping people over the course of 72 hours and then leaving them be. This really needs to be an invested effort on behalf of everybody.
Well, I do want to thank you both for spending some time with me on this today and talking about it and the wider picture of what's going on in the county and really across all of California. The website there on the screen is where you will find the report right there on the homepage. It was still there today when I checked. So obviously, if you haven't had a chance to take a look at this report, please do. It is really gripping and eye-opening, and just shows you exactly what's happening in all of our systems with regard to behavioral health. So thank you both for joining me. Really appreciate it. Excellent conversation.